Cardiac care at Barnabas Health is really rather unique. We go all the way from very hands-on care at the community hospital level, all the way up to specialized heart failure and cardiac transplantation services.
It ranges from the mundane to the highly complex and highly sophisticated. We can do electrocardiograms, we can replace aortic valves percutaneously and send patients home the following day. We can provide mechanical support devices to these patients. We can do heart transplants. Very few medical centers in the United States can claim that breadth of service.
I think the most important thing right now is to change from the thought of doing procedures to the whole process of where people fit into the spectrum. Historically, you go to see a surgeon because the surgeon can do a procedure. He can do a heart valve, he can do a bypass. What we really have to do is look at the whole spectrum, have collaborative efforts of all the physicians that are involved as to where along this whole spectrum of treatment the patient lies so that we can individualize the treatment for each patient.
The beauty of being within Barnabas Health is that absolutely everything available anywhere is available within the system, from high-tech defibrillators to advanced cardiac surgical services to even cardiac transplantation. And fortunately, most of the patients don't need this advanced type of care, but the ones who do have ready access to it and are the beneficiaries of it.
A heart attack is basically a clotted artery. An artery going to your heart clots, no blood flow, heart muscle dies. Got to get that open really fast. So in the old days, we gave drugs to do that, and it was found over a decade ago that instead of using a drug, using a balloon to push it out of the way is the most effective way to go. Door to balloon time is a measurement from our door in our emergency room until the first inflation of that balloon in our cath lab. And that needs to be under 90 minutes.
We are all part of the door to balloon 90-minute protocol to open up the coronary arteries as quickly as possible. The quicker you open up a coronary artery, restore flow, the more muscle you save of the heart. We use a cardiac catheterization as a diagnostic tool to pinpoint where the blockage is. Once we find out where the blockage is, we can then make plans on how to treat it. Barnabas Health Heart Centers perform more cardiac catheterizations, coronary interventions than any other system in the state. It's a great benefit for our patients to have their procedure within their own town instead of being transported to other cities, other states, other towns when they're sick and when they're ill. Once a patient has an angioplasty, we're not finished with that patient. There are many other medical problems this patient may have, such as diabetes, such as high blood pressure, high lipids. They could have rheumatological diseases such as lupus. And a cardiologist has to work with the other physicians of this patient, such as the internist, the diabetic doctors, to come up with a plan for this patient.
There's something to be gained by me working closely with my colleague. We really have that here. It's become more of an ingrained culture in this institution and others in Barnabas Health than any other place that I've worked.
We do see a lot of patients referred to us with congenital heart disease. Many of these patients are cared for collaboratively with the pediatric cardiologist, pediatric cardiac surgeon, or the pediatric interventionalist.
The connection with pediatrics is incredibly important because those patients with these issues, at a young age, are going to become adults at a certain point in time, and the expertise that we learn from our peds colleagues is very important, of whom there are several, and I've relied on several of those colleagues in order to help me in the adult congenital realm as well.
The goal is obvious. It's to provide the best health care to the patient. And that's what we do on an ongoing basis in the Barnabas Health Heart Centers.
We have the facility to pick up the phone, call another physician in the system who may be an expert in heart failure, who may be the expert in open heart surgery. They can look at the case as we're discussing it with them, and this is all done within 10 minutes of doing the procedure, and we have a consultation on the phone before the patient even leaves the cath lab to discuss the options for this patient.
We do whatever is necessary to make sure that we know exactly what we're dealing with, and with that knowledge in hand, we can then tailor the specific program for the patient. The art of medicine is really doing the right thing for the right patient at the right time.
When multiple people get together and try to decide on how best to apply the science, I think that happens best in a collaborative fashion, which is really what one of our strengths is.
We understand what they need medically. We have research protocols, we have technology, we have medications that can help them. But the most important thing, perhaps of all, is to understand that each of them is an individual, and they need to be treated as an individual, and they need to be provided with the compassion and the care and the support that they and their families need at a very difficult time in their lives.
It's been very gratifying hearing what some of the patients and their families have been saying about the program and the successes that we've had.
We have many patients who have heart attacks come in, 2 to 3 days they're out of the hospital, 6 months later they're jogging.
It is one of the best feelings in the world that you could save a life, you make the families happy, the patients happy. There's really not words you can say on how that makes one feel.
Patients who really were afraid to leave the house are now engaging with their families and friends again. Feeling better is a large part of this. Keeping patients out of the hospital is a large part of this, and we've been successful right along, and I think the patients and their families have responded to that and are grateful for it.